I'm joined this morning by Chris Walker, Emergency Preparedness Coordinator for the Hamilton County Health Department. Good morning.
Morning, ma'am.
Let's talk about the numbers that came out over the weekend. Nearly 8,500 new cases on Saturday alone. What does it look like here in Hamilton County?
We're following along the same rate as the state, the same rate as the region. We've had some pretty alarming days. We've been over 300 cases twice in the last 3 days, and no relief in sight, unfortunately. We've now exceeded over 10,000 cases in the county alone. And, we're working to get this under control. We're going over the governor's executive order that took effect yesterday, Sunday, and looking at trying to get the community involved for its own well-being here. And I think you've got some information that you wanted to share regarding this holiday season. So why don't you go ahead and take it away?
Yeah, so we put together this Show Some Class campaign at the beginning of the school year to really kind of talk to students and their families, give them 5 acronyms of things that they could do to keep the kids healthy and in class. But we're changing the acronym up just a little bit for this holiday season because of trends that we're seeing, as well as guidance about the smartest ways to celebrate the holidays this year. So our C for the acronym is Celebrate Virtually. We prefer that you celebrate with only your immediate family this year if you can. And for those extended family members, if you can put together a Zoom call or FaceTime, maybe have a toast virtually or share dessert virtually, that's what we would recommend. We're asking folks to limit travel. The Centers for Disease Control say that there's proof that traveling helps spread COVID-19. So if you can stay close to home this holiday season, that would be our preference. Also, avoiding any in-home gatherings. You don't know who's sick by looking at them. And we need to make sure that we protect the sanctity of our homes this holiday season by only having our immediate families. So no friends, no extended family. That's the safest way to keep that area healthy for you and your family. The first S in class, we're asking people to speak to contact tracers. We're seeing a very low percentage of people who are actually picking up the phone once they've contracted COVID-19. And that's important to us because we need to be able to contact the folks maybe you came into contact with so they're not out and about spreading it as well. So if you can please pick up that phone. They have also, I think, texted some people in order to get a hold of them. But if you could help participate, that would be great. And then the last S is to stay home if you're sick or you're waiting for COVID test results. And that doesn't change. That was the same S we had in the Show Some Class earlier in the year. Now that we're kind of through that, Chris, do you have any other suggestions for folks for around the holidays?
I think the same holds true as always. You need to wear your face mask. I don't know how many times we've said it, but apparently we've not said it enough because we still see people occasionally, and we hear much more than I see, at least, about people not wearing their masks. You're wearing a little piece of cloth over your face. And that little piece of cloth may save a life. I think that's the key to it. You need to continue washing your hands. Not only are we in COVID season, now we're in cold and flu season to boot, and the good hand washing helps prevent all three. And we still need to continue to socially distance. One of the things that's been touted more, continue to do your outside events as you can. Bring outside in. That's bringing outside air, keeping air circulating when you have to. But as you alluded to earlier, the best bet is to just keep it to your immediate household for the foreseeable future, especially with the holidays coming up.
So there was this morning about Moderna possibly being able to release its vaccine here real soon. News from Pfizer last week. What are we doing as a county, as a state, to prepare for these vaccines to possibly be released? How soon might we be able to see them?
So we have been planning for vaccine for quite some time now, basically since COVID started. We knew at some point we would be doing something along the lines. We just didn't know what it would be yet. But we've been given our marching order, so to speak, that the vaccine is coming as early as next week. Wow. For distribution. However, it is a very highly focused vaccination process. The vast majority of deaths are occurring in long-term care facilities and the elderly population. So the focus is to get the vaccine to healthcare providers first and foremost. 3 of our hospitals in the county have stepped up to be, it's called phase 1A. They're going to be phase 1A providers, and they're going to assist all of healthcare in Hamilton County to get vaccinated as the vaccine becomes available. We're going to start focusing on that long-term care facility staff first, and we're going to start spreading out into the folks that work in the COVID units in the hospitals and in the emergency departments, and then spread out through all of healthcare. The tricky thing is that, you know, not only is this a Hamilton County issue, it's a statewide issue, and there's over 400,000 healthcare workers in the state alone. And each person needs to receive 2 vaccines. So that's 800,000 doses just for healthcare workers. So it's going to be a process. It's going to take some time to get done. You know, it's something that we've actually trained for years, dating back to the early 2000s and even before. So it's not something completely new, but we do have to prioritize the work. We will get to mass dispensing in time and getting vaccination out to the public in time. We just don't know when that is yet. So we are working on it. We're working with our partners at the hospitals, at the long-term care facilities, within government, at local, state, and federal level. And we do have the plan to get it going. We're waiting on everybody to get their vaccines approved and authorized, and then get production ramped up is what we're really waiting on for the large scale vaccination process. But this is going to be a large, long-term process here.
So with the numbers going up and obviously a real wait for everyone to get vaccinated, final thoughts, what should we be doing this week as we head into the holidays?
We've got to do the same thing we were supposed to have been doing all along. Social distancing, wearing your mask, keeping your trips to essential trips only. You know, if you are sick, get tested. The great thing is that we now have rapid tests available for symptomatic individuals at our testing sites at Trinity Free Clinic and Aspire. They can do a rapid test, but again, only for symptomatic individuals. If that rapid test comes back, you still have got to get a PCR test as well. That is one of the nasal pharyngeal swabs as well. But, you know, the options are out there. Get tested. If you're awaiting results, stay home. And please, 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 I know you've put it out on social media and we'll put it out again. Answer the phone when the contact tracers call. We have the phone numbers. We will be putting it out for everyone to put it into their phone so they know who's calling them. It's really important for your safety and for the safety of others.
All right, Chris Walker, Emergency Preparedness Coordinator for the Hamilton County Health Department. Thank you, sir.
Thank you, ma'am.